This is another classical example of a skin disease in which the histopathology does no justice whatsoever to the skin disease. In fact, it almost misleads you. Well, let's describe the skin. We could see hair follicles, we could see deep dermis, we could see papillary dermis, we could see epidermis. And really, in all honesty, the only thing or the most prominent thing you would notice abnormal about this is that there is a hyperkeratosis. It's almost as though these wavy bands of thickened stratum corneum are forming little plaques or scales, because you see an area here in which there's kind of no hyperkeratosis, and perhaps you see another one here. So you'd imagine that this might look like kind of a scaly lesion on the patient. And that's why the microscopy really doesn't do this patient justice. Here's a picture of the actual patient. And if you do notice that this little area of hyperkeratotic scale would appear as like one of these many scales that you see just above the knee, giving the appearance of fish scales. The Latin word for fish is, or maybe it's Greek, is ichthyosis. So this is ichthyosis, and this is why it's called ichthyosis. It's mostly in kids. It's a genetic skin disease having a very complex genetics, and the end result is that the clinical and pathologic manifestations would be scales of hyperkeratotic plaques. Thank you very much.